Today I have another guest from the Netherlands, and her name is Ted. Well, it's an abbreviation, isn't it, for Bernadette? And she's in Maastricht. I don't know if I pronounced that correctly. It's difficult for us Westerners to speak the Dutch language with all of the curling of the tongue. But she's going to talk today about her dramatic improvements over the last 3 years that she's been part of the Paddison Program. She's followed the program and also been part of our support group, so I've watched her progress and heard her updates on a regular basis. But this is the first time that we've had a chance to meet face-to-face, and I'm excited to hear it as a summary and go into all the details of this rather than just getting the updates and answering questions. So thank you so much for coming on this episode and sharing your story.
Well, thank you. It's an honor for me to speak to you live. And I'm doing very well. I'm very energetic, very happy. I feel great. Yeah.
Awesome. Now, walk us through how it began and some of the challenges that you faced, starting out, first of all, with your official diagnosis and how long ago that was, and the first course of treatment.
Yeah. Well, it started in 2004, 15 years ago, and it was a very warm, hot, humid, sunny day, summer day, and we were sitting outside with friends and family, and very cozy, everything perfect. But I eat a lot of cherries. We had a buckets full of cherries.
Right.
And I liked them. And we went to bed. And after 2 or 3 hours, I wake up with a terrible pain in my right knee and a very swollen right knee. I couldn't believe that could happen in a few hours. It was very strange. And that didn't went away anymore. I recognized it because I had it sometimes before the same, but then after a few hours it disappeared. When I was 18, when I was 35. So I thought, well, this will disappear as well. But it didn't. It got worse and worse. I got very sick, tired, a lot of pain, very heavy pain, 24 hours, 7 days a week. I went to the GP and he told me, oh, you must have had a little trauma on your knee. And I said, no, it's something different. I think it's reuma. We call it here in Holland reuma, rheumatoid arthritis, because it's in our family. And he said, no, it isn't. But I wanted to have, I wanted to go to the hospital. And he didn't think it was necessary. But at the end, he wrote a letter. And then I made an appointment. But that took so many weeks before I could see a rheumatologist. And I worked in the hospital at that moment. So I went straight to the nurse from the rheumatologist. I knew her. And then I could, she asked the rheumatologist to come, and she said, yes, it's very worse. You have rheumatoid arthritis. They did a punction and examined the fluids, the fluid from my knee. It was a lot, I think 100 milliliters that came out. That is a lot. It looked like very organic apple juice.
Yeah, kind of a bit of a yellow tinge. Yeah.
And then she confirmed, yes, and my lab results were also positive. So it was rheumatoid arthritis, and I was in shock. I couldn't believe really that I had this.
You would have been familiar with it, with the severity of this condition from your family members. Is that right?
Yes, and even then I was in shock that my own body, that I couldn't trust my own body anymore.
Yeah,
that was the biggest issue. And then all this medication, I couldn't believe it was for me. I really was in shock.
What did they suggest?
I had to start immediately with Methotrexate,
Mm-hmm.
prednisone, very high doses.
How high?
I think 40 milligram.
Right.
I started.
Yeah.
40.
Yeah.
And they injected also prednisone in my knee.
Uh-huh.
And then I had a painkiller, but that didn't do anything. That was it. Yeah.
The shot
yeah.
At that point, was it mostly just in the knee?
At that point, it was only in the knee.
Okay.
Yeah.
Well, that treatment seems excessive. Certainly,
Yes.
certainly, at the very least, effective for that situation where you've just got basically one big swollen knee. I ended up with one big swollen knee. It was a situation where it was non-compliant, where everything else that I was doing was working fabulously, albeit over a long period of time, took years, but everything was responding. But my left knee just would not respond, and it was remaining swollen, stiff, very painful. And it turned out after many years of feeling that I was going to get there naturally, I had a steroid shot into the knee, and that totally cleared it. It was as though I had a closed loop of inflammation. It was like I wasn't, whatever was happening in the knee was isolated from the rest of the body. And so an injection cleared out that inflammation, and it was very effective. So given that you also at that time just had the inflammation in the knee, I imagine that after just even the steroid shot, you were probably walking around reasonably well after that, and then the oral dose of steroids, and then the methotrexate, all the stuff kicking in at the same time. You probably felt good for a few months, right?
I felt good, but
I know this is 16 years ago, so it's hard to remember.
I needed a wheelchair because I wasn't allowed to walk. I had to keep my knee in rest.
Why?
They told me.
That's crazy.
I don't know.
That's
I don't know.
crazy.
Yeah.
The opposite is true, because you would have, if the knee would have become, even in that short period of time, like a month or two before you saw the rheumatologist and got that, the knee would have started to become weak, and the connective tissue at the top where the quadricep meets the top of the patella, that would have become a little bit, again, like weak and started to become brittle. You got to use them when you've got an opportunity to use a joint. I mean, that's all it's there for, is to move, and we have to use it when it's free of inflammation.
Yeah, you're right. Because very soon I already had muscle loose in my leg. I could see it.
Yeah.
And that's very quick.
Mm-hmm.
But I was so in fear and so depressed because I followed exactly what they told me.
Yes.
And did what they told me.
Yes.
And so that went on.
Mm-hmm.
And then months later, I'm not sure about the time, but a period later, I also had these problems in my left ankle. So my knee was okay, but my left ankle started giving problems.
Yes.
Even when I had this medication.
Right. Yeah.
And that, that was the same pain, and the problems were the same.
Were you still taking prednisone?
Yes. Yeah.
So what I think has happened here, and my views, I believe, are fairly unique in that not many people share this kind of extreme negative view about prednisone. But my feeling is that if you've got mild let's say your symptoms with rheumatoid arthritis are 5 out of 10, and then if you were to take oral or injectable, like in the backside, prednisone, for a period of several months, whilst it keeps the inflammation level down from a 5 to maybe a 1 or even less than a 1, during the time you're taking it, you are basically counting down the days until suddenly your symptoms that it is suppressing are going to double or show up somewhere else. It is the worst drug for creating more rheumatoid arthritis symptoms. And so my feeling on what you've described is that massive intervention, big injection into the knee, that would have been sufficient, in my view, to see how you got along and then rehab the knee. Immediately start exercising it, do some squats, get it moving, walk every day, right? But instead they've gone the jab in the knee, then they've gone the prednisone, and this is the worst, the prednisone ever. Why? Why prednisone when you've just had the knee injection? And then the methotrexate on top of that. So you've basically just gone, boom, all these meds, and the prednisone has eaten or depleted your mucosal lining, nowhere for the bacteria to live, created leaky gut or more leaky gut, and you're in a situation a few months later. So that's what I think happened there. And, the medical community, whilst they're trying to treat you, can also be held accountable for some of the things that these medications do as side effects, because it's terribly detrimental what they can do.
Yeah, but at that time I didn't know all this information you tell me now.
I know, and Ted, nor did I. And if my doctor had have said take prednisone, I definitely would have taken it.
Yeah.
And in fact, I went to him one time when methotrexate was maxed out at 25 milligram, and I'd been doing my research myself, and I said, I hear that you can get an injection, a one-off like injection of steroids into your backside or whatever, and it'll give you a few months relief. I said, maybe that's something that we could try. And he said, I don't do that in my practice. And I said, kind of, why not? I was just so shocked by that. The last thing I expected was that, I don't do that. And his response, I can't quite remember, unfortunately, the exact response, but it was along the lines of, I don't think that the long-term benefits outweigh the negative impact of those interventions. And at that time, I didn't know what that meant, but clearly he had a more acute understanding of this steroid treatment than what a lot of other practitioners do. So, to this day, I just thank God that he does not do that in his practice.
And is that a GP or a rheumatologist?
Specialist rheumatologist.
Wow.
Yeah.
Wow. Good.
Mm-hmm.
Well, I can remember very well that rheumatologist at that moment when I came in the hospital for the first time with a swollen knee also asked the professor to come.
Mm-hmm.
She said, well, you are in a very worse situation and you are much too young for having this disease. So we have to put everything
at the same time.
Yes. To attack this.
Mm-hmm.
And I felt like, okay, yeah, it's okay. I don't know what's the best for me, and do what you want because I'm sick and I don't want to have this pain anymore.
Yep. The pain's shocking.
The pain is shocking for me.
Oh, terrible. So it showed up then, you said, in your ankle. Let's go through what happened next. So you remained on the steroid, the methotrexate. It then showed up, you said, in your ankle. Yeah, I know.
Yeah.
Yeah.
And that lasted a very long time because they couldn't find anything in my ankle. And I could exactly point to the places where the pain was. And then they made an CT, an MRI scan.
MRI, yep.
MRI scan. And then it showed up that my ankle already was damaged very worse. A lot of loss of cartilage.
Cartilage, yes.
And that was, I think, 5 years later.
Right.
So I lived so long with this pain. That was terrible. And then they decided, well, this is the moment you can start with biologics. And
now, if we're going back 16 plus minus 5 is 11. 11 years ago, they would have probably recommended Enbrel.
Ambrel, yes,
Yeah.
yeah,
Mm-hmm.
yeah. And it is, I think, 10 years ago I started Ambrel,
Mm-hmm.
and that was such a big relief.
Right.
That's unbelievable.
Yeah.
Unbelievable.
Mm-hmm.
I felt newborn.
Yeah.
We celebrated because after a week I could walk normally, and we went to the zoo to celebrate it. That's unbelievable.
Mm-hmm.
And I was very happy with this Ambrel because it
Yes.
helped so good.
Yes.
But after, I think, 2 or 3 years, all the infections started. And that were the side effects of the Ambrel.
The infections. Mm-hmm.
Infections,
What did you
yes.
get?
It always started here in the nose with the cold, then the throat, and finally my jaw bones were infected, my lungs, pneumonia.
You got pneumonia?
Yes, several times.
Oh my
And
gosh.
then that was the moment I started by antibiotics.
All right, the story's
So
getting interesting. Yeah. Okay, okay. Now I was going to make some comments about Enbrel. The comments I wanted to make was I see this frequently about Enbrel. Enbrel gives fantastic pain relief, life-changing stuff. And one of our other guests who's been on the show, Katie, of course, who
I know her.
Yeah, Katie. She's been on Enbrel for, gosh, I want to say something like 10 plus years. It might be 15 or something. I mean, a very long period of time, and it was life-changing for her. I frequently hear great things about the pain reduction and symptom removing effects of Enbrel. Forget the side effects for a moment. We're just talking about effectiveness of its treatment. And it surprises me that it's so much less recommended these days than what it used to be. I mean, the drug's still available, but these days it seems rheumatologists are opting for from a vast selection of biologic drugs that are maybe the latest or the newest and more interesting. But I don't see them working near as effectively as the feedback that I constantly get from Enbrel. So I'm just sort of saying these things for our viewers or listeners who'd be interested to get that insight that I see frequently that Enbrel gets great results. And of course, I'm just speaking from the feedback that I see from our forum members and from emails and so forth, because there's just a vast number of people giving me information and I hear it frequently. So why it's not more recommended, I don't know. Whereas things like Xeljanz, which is a tablet biologic, I hear frequently bad things about that it didn't work or that it's terrible side effects, and yet it seems to be recommended more and more. And yet, again, my little view of the world and the way that I gather information is quite unique, which is just from feedback from people with rheumatoid arthritis. And these are some of the trends that I see. Enbrel still works, and these new ones just don't seem to work so good. So anyway, thanks for letting me share that little bit of information. Okay, so pneumonia, goodness, several times. This is serious stuff. And then so talking about antibiotics, now you can see the frowns come over my face when I hear antibiotics, because that's, of course, how I developed rheumatoid arthritis.
Exactly.
Oh my gosh, tell us what happened when you started that.
First of all, the Ambrel was perfect. So after a few years, I got these infections. And they were getting worse and worse. And at a certain moment, they were so worse that I had to use the antibiotics not only for a short period, but for a long period.
For the infections.
Yes, 3 months. At very high doses, because I had a very large infection on my jawbone.
Right.
There was a hole between my mouth and my sinus. Because of the infections, it was very worse. I had several operations.
Face operations.
Several operations here.
On
very
your face,
painful. And the inside on my jawbones.
Gosh.
Yeah, my how do you call it here? This
Under the cheekbone.
yeah, under the cheekbone.
And they did a fabulous job because you can't see any
Yes.
insertion or anything.
No, they did it from inside.
They went
That was
in through the mouth. And
yeah.
what?
Yeah. A
See,
transplantation.
people who don't have inflammatory arthritis, autoimmune conditions, could not imagine the kind of things that we have to go through when you have these diseases and then try and treat them with these medications that can cause so many problems. Just before we started our conversation, you talked about your participation in a study, and we'll get into that in just a second. But that's going to be a perfect segue as to why people don't talk about this disease. I mean, who wants to tell their friends, I'm going for face surgery for my cheekbone because of some space in here that's been caused by all of the side effects of this horrible medication that I take for this terrible disease that I have? I mean, goodness me. I mean, you can understand why people don't want to talk about this stuff because for want of a better word, it's just sort of ugly, isn't it? It's just not nice. It's hard, and so I can completely relate to the mess that we all go through with this condition. So
it's very much, yeah. But you never can see it at the outside.
Mm-hmm.
That's the problem.
Mm-hmm. Yep.
And people always say, "But you're looking so good.
Yeah,
you're looking so well."
Yeah.
They don't understand the problem you are dealing with.
That's right.
But then I had to use antibiotics for a very long period, and then you have to stop your biologics. And then after that, when it all was healed, I had to restart it, and then it didn't work anymore. That's also not from the Enbrel.
And so the Enbrel did not work after you stopped it for a while?
Yeah.
Again,
and that's
common, really common, very common. Yeah. If you'll allow me just a moment just to share what I see from other people. When some people, for example, are taking methotrexate for a period of time, and then after they're on methotrexate for a while, maybe their liver enzymes go up, which are the ALT and the AST readings in your monthly blood test that you have to have with. So if their liver enzymes go up, the rheumatologist knows from their education that that's dangerous and we better take them off methotrexate. Now, I was fortunate. My rheumatologist realized that I was on a fairly stable platform with my drug treatment, and he said, I don't want to stop the drug. Let's increase folic acid. We'll put folic acid the day before and the day after of your methotrexate. And my liver enzymes came down enough for me to stay on the medication. Now, I don't see that kind of temporary test intervention done much by other rheumatologists. They'll often see some liver enzymes go up and they'll say, you got to stop the methotrexate.
That's true.
People stop the methotrexate. Within 2-3 weeks, sometimes a month or even 2 months at the most, the liver enzymes come all back to normal. All their symptoms come back. They go back on a methotrexate. Now it doesn't work. And they've been on it for years.
Yeah.
And so I see this personally, and I'm sure rheumatologists see this all the time. So, there's not really an action point here, but it's just a cautionary insight that when our treatment's working, don't mess with it because it's just as delicate as the healing process of the gut where everything must be, I say the path through the mountain is very narrow and it's a tightrope, the medications as well. So once it's working, boom, let's just not rock the boat. And if we need to kind of find little tricks like the folic acid trick to stay on a drug if it's otherwise working, then we should do it.
Yeah. Never heard that before.
Oh, right. Yep.
Never. No.
Mm-hmm.
So you took the folic acid before the methotrexate.
So there's 2 ways of taking folic acid with methotrexate. One is to take a little bit of folic acid every day except the day that you take the drug. So you do 6 days of folic acid in small dose and 1 day of medication. And the other way is to take 1 day of folic acid the day before the 1 medication, and the folic acid is a large dose. I think it's 5 milligram. Don't quote me on that. It's been a long time since I've taken folic acid. And so my rheumatologist said, take one also the day after. Okay, so we're going with one the day before, then my drug, then another one the day after, because the drug metabolizes the folic acid. It just uses it as part of its it consumes it as part of its working mechanism. And so we don't want the drug consuming our own reserves, our human reserves. We need to supplement it so it uses up a supplemented reserve. And anyway, that did the trick. It did the trick for me. And if there's anyone sort of, paying attention here who's in a situation or in the future where the ALT, AST go up, which is very common with methotrexate, definitely something to speak to the rheumatologist about if the drug is going well, because stop-start technique does not work out too good for too many people. So, look, and if the enzymes continue to stay elevated even after that little intervention, well, safety needs to come first, and a discussion about, the drug usage or not is obviously on the table for the rheumatologist. But, that little trick worked for me.
Yeah, perfect. Yeah, I didn't know that, because here in Holland, you always have to take the folic acid 24 hours after the methotrexate.
Well, you know what? My memory might be fading just a little, because I was diagnosed in 2006, only 2 years after you. So it's been 14 years, and of those, only I think only the first 5 was I involved with drugs. So, but I think it was the day before. So anyway, look, we'd have to do a survey in our forum and find out. But anyway, let's pick up your story and talk about how you felt after the Enbrel stopped working, after the antibiotics, and where did you go from there?
Well, then I had to start other biologics, and I wrote them down.
Yeah.
First of all, Orencia. That was via intravenous. I don't know how to say it.
Yeah,
via
intravenous. Yeah, we say. Yeah, you said, yep, intravenous. Yep. How frequent were the intravenous?
Once in 4 weeks. Every 4 weeks, 1 day at the hospital. But that didn't work.
Okay.
That didn't work.
Yeah.
Then I had tocilizumab.
Say that one again.
Tocilizumab.
Yeah. I've seen the word. I've never spoken it out loud. I'm familiar with it. How did that go?
And that was awful.
Awful.
Because that has a very, very nasty side effect. Tocilizumab interferes with your autoimmune system, but also can interfere with your ESR.
Oh, really?
So, that's very nasty. You can be very sick. For example, appendicitis. And then your ESR normally raise very much. But this tocilizumab suppress your ESR.
Right.
ESR, is it? Isn't it?
SED rate. Yeah, one of the inflammation markers.
So you maybe have an ESR from 100 millimeters, but because of the tocilizumab, it's 0.
And so you're not aware of some of the inflammation in the body, which means that you could be having something terrible happening, and you don't know. Right.
But with me happens the opposite. I got very high ESRs.
Right.
That was also very strange. But it's clear that the tocilizumab didn't work.
Okay. No symptom relief.
No.
Okay.
And then I had to go to Humira.
Okay.
That's very famous, Humira.
Yeah.
And that didn't work at all.
Okay. Yep.
And then
I think the mechanisms are somewhat similar to Enbrel.
Yeah, from Humira and Enbrel. Yeah.
So if I've seen people explain before that their doctor had them on Enbrel and then said, well, don't worry about Humira because it's a similar mechanism at play. Whether or not that's totally accurate, I'm not sure. But yes, let's go ahead from there. So you failed. What happened next?
Well, in the meantime, I discovered the Paddison Program.
Okay, good. Now we got some positive news.
Yeah. 3 years ago, because all those medication didn't work, and I had, I think it was before the Humira already. I'm not sure about it anymore. It didn't work at all. I had swollen knees, swollen ankles, very, very worse. I can remember the most awful period is Christmas 2015. I was so in pain. I only could lay in bed. My husband had to take care for me. I couldn't walk.
Yeah.
I was completely stiff and I couldn't sleep because of the pain.
Mm-hmm.
And the medication didn't work.
Mm.
And then I found the Paddison Program. And I had to start a new biologic. And I wanted to start the Paddison Program. And that was a very interesting period because at the beginning of the new year in 2016, I came to the rheumatologist and she saw how bad my situation was. And she suggested a new biologic. I don't know exactly which one it was. And I wanted to start the Paddison Program. So I thought, well, I wanted to read a lot about it and to prepare myself. And I thought, well, if I start with a new biologic, I don't know if the Paddison Program will work for me.
Yeah.
So I wanted to wait with the biologic and first start the Paddison Program because my situation was very bad.
Mm.
And I can remember very clear that my knee was swollen, I was in pain, and the nurse from the rheumatologist called me by phone. Are you already started with your new biologic?
Yeah.
And I said to him, no, not yet, because I have a flu. But I want to have time to see how the Paddison Program worked.
Yeah.
So I started, and within 24 hours, I could walk.
Wow.
I had no pain. I could get up from my bed without help. I could walk to the bathroom. And within 24 hours, it was unbelievable. I couldn't believe it. So for me, it was clear the Paddison Program works. And then after a week, I also started the new biologic. I don't know which one it was.
Mm-hmm.
And for me, it was 100% clear. This works. This diet, because first I start with a diet and not with the exercises because I wasn't able to do exercises at that moment.
Yes.
It was very, very impressive. So I was very motivated to go on with the program and the diet. And from day one until now, I never, ever had this pain again.
Wow.
Never. Swollen joints, yes, but never in pain.
Wow.
But it's the best motivation for me to go on with the diet and the whole lifestyle change. Yeah.
Yes. Wow. Okay. Now you mentioned that you still get the swelling, but not the pain. That's really interesting.
Yeah.
Which joints? Now we're kind of skipping 3 years here, but we'll come back to those. Which joints get the swelling and not the pain?
The only joint that is a little bit swollen is my wrist, my left wrist.
Mm-hmm.
I have no pain at all.
Mm-hmm.
And that's already for 3 years.
Mm-hmm.
And the rheumatologist, did it several times punction to take the fluid out and to give prednisone in it, but no improvements at all.
Oh.
But no pain.
Yeah.
Never pain. My knees sometimes are a little bit swollen.
Mm-hmm.
And then I exactly know, okay, I had too much from this or I had too much from that.
Yes.
With my diet.
Yes.
Or I think stress. Stress is also for me a trigger. Let's say it like.
Yep.
But I have no joints with pain. Never. Never.
It is absolutely remarkable, given that where you were. I mean, if this was the first interview that I had ever done with one of my clients, and them tell me that, I would just be like so like gobsmacked and just talking about all the details for the next 10 minutes. But like, you know that every guest that we have on the show has one of these unbelievable stories. And so it's kind of like, oh yeah, Ted just got rid of like 10 years of excruciating pain. Cool. You know what I mean? Like you kind of do get a little desensitized to the enormity of the stories sometimes. But I mean, let's just for a moment just acknowledge how incredible that is. I mean, it's absolutely remarkable. Now, in the Netherlands, everyone likes to, I believe, eat lots of cheese. So were you eating a lot of cheese prior to starting the program? What did your diet look like?
Well, I had a really healthy diet.
Okay.
We didn't eat meat every day. I indeed eat a lot of cheese. That's true.
Yes.
And a lot of milk.
Uh-huh.
We are raised with the idea that milk is necessary every day.
Yeah.
Yes, I eat a lot of cheese. Yeah. A normal healthy diet. Let's say it like that. Yeah.
Right.
Yeah.
Healthy compared to the average Western diet, but not healthy in the way that we know that we need to eat when we have to heal a terrible digestive problem, right?
Yeah. Yeah.
It sounds to me, given that you probably were eating, somewhat healthy again compared to the average, Westerner, that maybe a large portion of your inflammation came from dairy products. You mentioned the milk, you mentioned the cheese, you haven't eaten them in 3 years. I'm not saying it was just that, but they were probably a large portion of it, given that you weren't eating meat every single day. I tend to see it more often anyway, that the dairy seems to be more inflammatory and more of a trigger for people than what just animal proteins are and animal fat. Just the casein in the dairy, the mucus forming nature of it, it's so allergenic. It's just not human food by any stretch of the imagination. And so it was probably playing a larger role than what...
I don't know, because I already discovered before the Paddison program that sugar was a bad trigger for me.
Sugar, yeah.
Sugar.
Yeah.
And now I'm also convinced that oil and fat is very bad for me in my situation.
Oh, most definitely.
Yes.
Most definitely. So oils, if we listed them from number one worst possible thing you could eat if you've got an inflammatory condition, is vegetable oils. Is absolutely number one. Like if we took a group of 50 people with an autoimmune condition and as a horrible torture made them consume the oil that fried French fries are cooked in a shot glass the night before they go to bed, the next morning every one of those 50 people are going to be swearing at me and very, very angry because of the inflammation in their body. Not one person will escape the shot glass of sunflower oil or whatever cooking oil inflammation that will follow. It's just as straightforward as that. And then with time, it's possible to tolerate non-processed fats like nuts and seeds, for example, and things like chia seeds is something that I'm actually encouraging more people to eat once they can eat nuts. If you can eat nuts, people should definitely be eating chia seeds. Because
I don't dare.
Sorry?
I don't dare to eat.
You're too scared. You totally
I'm
understand.
too scared.
Totally understand. Yeah. Totally understand. When the confidence is there and you're eating nuts and you're eating other seeds, for instance, like pumpkin seeds or sesame seeds or something, there's no fear whatsoever in trying chia seeds. And the benefit of the chia is their omega-6, omega-3 profile. It's hard to find foods that are rich in omega-3 and low in omega-6, and chia seeds are one of those. So if other people are watching and they're already able to eat a range of different nuts or tolerate a couple of nuts, chia seeds should be an easy addition and a really good quality addition, an anti-inflammatory addition. The issue is getting to that point. The issue is getting to the point where we can tolerate high-fat foods at all, and that took me years. So, one of the big milestones for me was when I took ground up flaxseed out of my smoothies, and I was putting them in because we were going with the generic information that you find on the internet that, omega-3 fats, eat them and your inflammation goes away. All right, let's put flax seeds in the smoothie. Inflammation like crazy. As soon as I took it out, again, just through experimentation, months and months of pain, doing the same thing every day, pain, excruciating, can't walk, Bikram yoga every day, 25 milligram Methotrexate, fingers swollen, ankles so bad I can barely walk, chest hurts, jaw hurts. I mean, absolute shocking. Take the bloody flax seeds out of the smoothie. Oh my God, it's like half my pain is gone. Now I'm only in agony as opposed to triple agony, right? And so these were big milestones, and taking the olive oil off my salad, that was another massive milestone. I didn't see the connection of being fat. It took me months to work that out as well.
Well, I can tell you a nice example of this, because I started the program 3 years ago. I was fully committed to the diets, and I followed it exactly step by step as you could read it. And then I lost a lot of weight. In 4 months, I lost 25 kilos.
Wow, that's huge, yeah.
And people around me, family, friends, everybody started saying, oh, that's not good. You're looking not good. You lose too much weight. You are on the wrong path with this diet. Please start fats, eating fats. You can't miss fats. So after a period and a few weeks that everybody kept telling that to me, I thought, well, I'm feeling okay, but maybe I'm wrong and have to start eating fat. So I started adjusting sesame oil in my food.
Sesame seed oil?
Yeah, sesame
seed. Oh my
seed.
God. You don't need to tell me what happened next.
It went completely wrong. I was I used a lot because I thought, well, maybe I need this and maybe it's better for me. And at that moment, also 4 months after starting the program, I got completely stiff.
Yeah,
completely stiff. My husband made some movies for me. I couldn't nearly walk.
Wow.
I had pain. That's strange. No pain, but completely stiff and swollen joints. Very swollen knee, ankle joints. And then at that moment, the rheumatologist gave me again more prednisone and all these things. The whole thing started again. And I thought, no, it's the oil.
There you go.
I'm absolutely sure it's the oil. So I cut the oil again.
Yeah.
And then it went better. Yes. It was a very good example from that oil is the trigger for me for inflammation. Yeah.
It's pure. Well, not pure. It's just extremely high in omega-6 fatty acids, which are an inflammatory trigger. Simple as that. So, yep, that's it. So you're basically just pouring gasoline on top of a fire. That's all that's going on.
Yeah.
And
True.
it's amazing that this isn't so well known. It's incredible. It really is. And people screw up their face and think, what are you talking about? Like, I lose people immediately. If I meet someone who knows someone with rheumatoid arthritis and I'm speaking to them on an airplane or, I don't know, like just at a social event or something, and they say, oh, my mother has that or my brother, whatever. And I say, okay, like, look, go home and the very first thing you want to do, if you want a massive intervention, I said, it's almost hilarious how fun this is because it works so well. Just give them 3 days and do not allow them to put any oils on their salad. No oils in the cooking. So you have to cook. Don't use the stir fry. Right? No oils for 3 days. Change nothing else. And I'm like, I guarantee you that you can get rid of a ton of their symptoms and they'll feel really great. And they look at you and they're like, no oil. What do you mean no oil?
Yeah,
and like, and
yeah.
instead of being excited about the challenge, 3 day simple challenge, they just get all like, what do you mean? But oil's good for you. And then I just start to lose faith in humanity and just give up. So, sometimes people go and do the challenge, which is cool. But, people are so brainwashed. It's brainwashing that oils are healthy. There's
the same with milk. Milk
right.
is such an essential food here in Holland.
Yes.
Yeah, you can't live without milk, cow milk, but, well, I can.
Yeah, absolutely. The statistics, when they talk about hip fractures and they talk about the false positives of milk, they always refer to the Netherlands because I believe that you're in the top 2 or 3 of hip fractures in the world and you also consume the most dairy per population. They also draw upon the statistics for New Zealand and Australia.
Yes, exactly. Yeah, that's true. Oh, I know. Yeah.
Yeah. So if you want a broken bone, go and drink more milk. You'll be getting there, sooner than everyone else. We've had
they say, sorry. Still here, they say the rheumatologist and the nurse from the rheumatologist that you need to have calcium from milk and from cheese. And I do my blood test twice a year, a whole range of things, also the calcium.
Yeah.
And my calcium is perfect.
Of course it is. Yeah.
Perfect.
Yeah, exactly. Yeah.
So what's the problem?
Yeah, exactly. It's for people who aren't as smug about this knowledge as you and I. In the program, there is a ton of leafy greens that contain lots of calcium, and there's a lot of other foods that contain calcium. But here's the kicker. Our calcium daily requirement is actually very, very low once we take out all of the things that strip our bodies of calcium.
Yeah.
Those things, namely, are animal proteins. So once we take our animal proteins out of the diet, because they're the calcium thief, if you remove the thief, then you don't have to repopulate the calcium much into the body because nothing's being stolen.
Yeah.
So, but the good news is that even under those situations, there's still heaps of calcium when you're consuming a plant-based diet like Paddison Program. I've chatted more than I normally do because I've kind of, first of all, it's been a long time since I've done one of these interviews. We've been in the States for a month, and so I'm a little bit of a chatty Cathy today because I've not had a chance to enjoy chatting with someone about these fun topics face to face for 5 weeks. So I've been talking a little bit more than I normally do. And so we've used up a little bit more of our time. But I'd like you to share I would like to at least cover the following couple of things, which is your participation in a recent study about anxiety and fear and so forth. And also then want to hear some tips from you from doing the program over 3 years that you've learnt that have been especially helpful. So why don't we go in that order? Talk about the study that you were recently involved in and why that might be interesting.
Yeah. Well, the University Hospital here in Maastricht did a study 2 years ago amongst patients with RA about, I have written down, gloomy. If
yeah.
people are gloomy, just
Gloomy.
not depression, but only gloomy.
Yep.
And it was an interview on paper. And the outcome was, as they told me, I don't know the words, surprise, because the outcome was that not the people were only gloomy, but very depressed and had a lot of fear and anxiousness. And not only the older people, but even the younger patients with RA. So they wanted to continue on this new outcome and started a new research about depressions and also in research on paper again. And they like to interview those people also personal. And so I went there a few weeks ago for an interview. And during this interview, I think it lasts 1.5 hours. I talked about my own experience and I realized, yes, I had this as well. I have completely forgotten this. I have suppressed it, let's say it like that. But I was anxious as well. And about what? Well, about my future, about can I be independent, about my pain. How can I live my life in this situation? All those things. And they came all back during this interview.
Oh, right.
And I realized, yes, I have gone through this as well. So it was also healing for me, this interview. And then this researcher told me that there were very less people who wanted to talk about this. It was a very difficult subject amongst people with RA, especially to talk about it. So I was the first one. And well, I'm very curious to the outcome of this whole project. Yeah.
Yeah. You'd be the only one who wants to go and talk about, how you feel and your moods and so forth, because you're on the positive end of the spectrum.
Yeah, exactly. Yes.
Because you've got knowledge that very few other people with rheumatoid arthritis have. Despite my best efforts to do interviews like this and to, create content and share it with people, still so very few people know this information, follow this program, or even something more generic, like just a simple plant-based diet. And so no one wants to talk about it. I remember that I would go through, anxiety definitely is the right word, about social events when I was highly inflamed. I didn't want to see anybody. I just didn't want to be social whatsoever. I didn't want people to once again question why I'd lost more weight, because I was on a raw food diet for 8 months, and you talked about a lot of weight loss. As soon as you shift across to raw foods, it becomes even that extra level of challenge to hold the weight. And I was doing Bikram yoga every day, which is, as you know, very calorically, what's the word? Uses up a lot of energy. And so I didn't want to see people. Questions like, or just the look on their face, just that extra half second that they look at you like, oh, well, something's wrong with him. You know what I mean? That guy's not doing too good. And so I didn't want that feeling. I didn't want to pretend that I was doing well. I'd have to kind of try and walk more steady, even though I was limping, and try not to limp. I just didn't want to. I just said to Melissa, I just don't want to see anyone. And this went on for a very long time. And the whole time I'm doing stand-up comedy. So I'm like the focus of Yeah. I'm like worried about how I'm going to step up onto the stage at some clubs, because I remember, that club, it's like the step up onto the stage is knee height. All right, so I got to be super careful when they introduce me that I'm right next to the stage so that I can step up with my good leg and then get to the microphone without drawing too much attention to my limp. I did some TV appearances where I just look at them and I'm like, just shocking. I just didn't like it. Now, what's crazy is people don't care as much as what we think. They think, okay, that guy or that lady, skinny or whatever, or doesn't look too healthy, but they don't think about it for more than a few seconds, except your family. And your family dwell on it. It's like weight loss to the family is almost like the ultimate signal that they need to get involved. They need to stop whatever it is you're doing. But if you're skinny to anyone else, they don't care. I got friends that like, mate, when you're skinny, you look good. You do skinny really well. I'm like, I don't want to do skinny really well. You know, I've always been skinny throughout my whole life, and I'm used to it. But it's nice. We all feel better when we feel like we've got a few more pounds. Anyway, I feel like I'm rambling. I could talk to you all night. Let's go back to. I apologize if I just chatting so much. You know, we've been overseas. I haven't done one of these, and then I got 3 little kids, and they just want to talk about toys all the time. And my wife wants to talk about the kids, and so I'm socially deprived.
Yeah.
Talk about your rheumatologist. Have you got the rheumatologist that everyone says is fantastic in the Netherlands and they're supportive of our program and is familiar with it? Have you got that rheumatologist?
Well, let's say it like this way. I have a fantastic rheumatologist from day one when I came for the first time, and I still come to her.
Yep.
But in your program, a very important issue is also that you learn people how to deal with your rheumatologist.
Yes.
And that was very important for me because normally I am somebody who says, well, this is what I do and blah, blah, blah.
Yeah.
But now I was very gentle and I respect her.
Mm-hmm.
And I told her honestly what I was doing with this program.
Mm-hmm.
And I knew she wasn't okay with it, but I am open to her, and we discussed it that we should be honest to each other.
Yes.
And she only did when I told her about the diet.
Yeah.
No.
Yeah.
And I said, well, I try it and I do it, and she was okay with it.
Yeah.
She didn't say that I didn't have to do it, but she had no confidence in it. No confidence. Yes. Yeah, not at all.
Mm.
And every time I have my appointment with her every 3 months, I always give her the day before an update by email, so she know already exactly. And I always write in the update also still on the Paddison program, diet, lifestyle, my weight, everything. And the first year, I think, she didn't ask anything about it.
Yeah.
But then slowly she asked things about it. And I also help her with teaching medical students in English. Then I am a patient who is, a study patient.
Mm-hmm.
And at the end, if they diagnose me and listen to my story, always the question is, how is it possible that you are now in this condition?
Wow.
Looking so well, looking so energetic, looking so vibrant. And that was what the researcher also said from this project. And then I asked the rheumatologist, do you allow me to tell why?
Yeah.
I said, tell them. And then I always tell about the Paddison program. And it's happened already a few times or several times. Immediately, they pick pen, write down How is his name? Oh, how is the diet? And how is the lifestyle?
Yeah.
And my rheumatologist, I don't want to bring her in a difficult position that I do something else that's without her treatment.
Yes.
So, but she is okay with it.
Yes.
And then after 2 years, I told her, well, Clint Paddison also had a special, how do you say it? You have written something special for rheumatologists.
Oh, yes. Yes, the guide for rheumatologists with the scientific references.
Yes.
Yeah.
And I had it with me. I had printed it out and I had it with me. And I told her that you had made this special for rheumatologists. Are you interested in it? Yeah, I am. But I didn't give it to her. And then when I went outside, she said, you should give me this guide. Don't forget to give me this guide. Yes, here it is.
That's great.
And then she never come back to the subject, but she slowly I think she slowly understands how important it is, at least for me. And she sees the results that I'm doing so good.
Yes.
So it's not a point of discussion with her.
Yeah.
She respects me. I respect her. And that's the situation. So I think she is, for me, a very good rheumatologist.
Yeah, it's perfect. Again, this is one of these situations that's not change anything. Yeah? You know, it's like the food, the medication, and once the rheumatologist relationship is pretty good and everything's working well, also something that we shouldn't go and change. We don't need to go and see a different specialist or another opinion once everything's
it's very delicate.
It's delicate, exactly. It's delicate. Yeah. These relationships are delicate. Quickly, and then we'll wrap up. Have you got any bullet points, tips for people that, for example, what would you say the most crucial parts of the program to follow if people are following it, what you absolutely must get right?
Well, for me the pain is the best motivator.
Mm-hmm.
And if I have some little problems because I have eaten something that is not good for me, then I know always go back to day one. I structurally do it every 3 months.
All right.
Day one and day two, so only juices.
Mm-hmm.
And if you have problems, not in my case, not with pain, but with swelling, go back to day one.
Yeah.
Can I tell about an example?
Yeah.
Well, last Christmas, I was very strict in my diet. It's a difficult period, Christmas time.
Yeah.
But I was very strict in my diet, but I drank a glass of champagne.
Yeah.
And that is okay. But then the next day or 3 days later, again. And it was a glass of Prosecco. And I like it very much. Only one glass of Prosecco. There was a bit of dinners in the evening. And then I went to bed. And I got a tremendous pain here in my chest. My chest bone, do you call it? Sternum?
Yep.
And I thought, well, this is not from my heart. And it got very worse. It's I think from the Prosecco. And then my husband told me, yes, because here you have very small, fine joints.
Exactly.
And it was connected with the breath and with muscle movements.
Absolutely. Yep.
And at that moment, I was not in fear or not anxious, not in shock, relax. If it's from the food or the Prosecco, then I can control it.
Mm-hmm.
And that's a miracle, because then I do the next day juice day, and it was even not necessary. Next morning, it was already disappeared.
Wow.
But I was so relaxed under it. And normally, all those years before, I always was very stressed, very stressed about the pain.
Mm.
And now I have a toy. Do you say toy to control it?
A tool?
A tool, sorry, a tool. A tool to control it.
Yeah.
And that's for me the most important thing.
Yeah, that's right. This is where I talk about the ultimate goal is complete confidence and control.
Yeah.
Once you have complete confidence and control, nothing can impact you in a way that you don't feel you can overcome. And, the chest pain, that's one of my classic spots in weakness in my history has been that chest. And I've experienced that. I remember that chest pain very much. It's agonizing. And so to know that you're able to switch that off in 24, 48 hours, and you did it even quicker. It just went away quickly. I mean, that's what it's all about, is feeling that you aren't subject to every twist and turn of the disease without having any control over it. That's the worst place to be.
Exactly.
So, yeah, that's where the anxiety is. That's where the worry, that's where the depression's at. So, yeah, awesome. Okay.
You can't trust your body anymore if you are diagnosed.
Yeah.
And now I know, well, sometimes I have a little swelling in my knee.
Mm-hmm.
I do juice day.
Mm-hmm.
And then I go to bed. And it's like a miracle. 3 o'clock, 2 o'clock, 3 o'clock. Slowly the swelling disappears.
Yeah.
And I'm in such a positive situation that I think I can control it. How is this possible? It's every time again a miracle.
Yeah. Yeah.
Yeah.
Well, that's a fabulous point where we might wrap up. It is. It does feel like a miracle, but I think I one time sat down and wrote out miracle as an acronym and came up with something like, I forget the details, but it was basically an acronym where it was massive, attack, and intervention so that you create your own result by working really hard. So it's not a miracle where the intervention is out of our control. The miracle comes from extraordinary discipline, extraordinary patience, and extraordinary mindset to be able to stick with it and to convince ourselves that this is all going to pay off and play the long game. So you've obviously done that, and what a tremendous outcome. So I've really enjoyed having a chat with you. It's coming up to 10 o'clock here at night, so it's a good time for me to sign off and go and get some rest and get ready for the little ones in the morning. And just thank you once again for sharing your story and for so many lessons, didn't we? We covered a lot of lessons in your journey, things that a lot of people may have come across themselves, and good to stop and have a discussion about those things so that we can all share what we know and make sure that we make the best decisions.
Thank you very much, Clint.
Thank you.
It was a pleasure for me. Thank you very much.
Awesome. Thanks again.
Bye-bye.